All right, so for those who don't know me, my name is Christine Lee, and I am a rheumatologist here in Beverly Hills. I work often with Lupus LA and think they're a great organization, and I'm happy to join you guys for a live Q&A today. Um, what I'll do is we wanted to talk about what is important for newly diagnosed patients with lupus to focus on. So I have a bunch of questions here that we'll go over. And then just briefly, I will go over the basics of what lupus is and which many of you are probably already familiar with. And then we'll start with the Q&A portion. So lupus, as we most or all of us know, is a very heterogeneous disease, and it is characterized by waxing and waning of symptoms. So sometimes people will do better, sometimes people will do worse. It mainly affects young women of childbearing age, and it is really important and critical that diagnosis can come early, and we'll talk about what to do about that, and also making sure you get to the right doctors and the right referrals in time. So what we want to say is the first question here is, what are the main symptoms of lupus that you look for during diagnosis? So what we focus on is what I characterize as constitutional symptoms. So a lot of things that may not necessarily be identifiable via lab work, and that includes symptoms such as fatigue, hair loss, rashes, general aches and pains um, that may not necessarily present in a severe way. And so sometimes we may feel that as patients, maybe this is something we can fight through, or it's not a big deal, or maybe it's because we were recently sick or had a stressful time at work. Things like that are just part of the diagnostic criteria. We also look at physical symptoms, and so as rheumatologists or other doctors, we look for stiff swelling in the joints as one thing, mouth ulcers, eye inflammation, hair inflammation, general rashes. In terms of lab work, looking at inflammation markers is super important, as well as general blood count or kidney liver function. Those all help us with the diagnosis. Another main part of looking at autoimmune disease is looking at antibodies. So what's important to look at is what sort of antibodies might be present in the blood. And some may be relevant, some may be not, and some we just carry, and it doesn't mean that we have lupus. So you may be familiar with some of the diagnostic criteria that maybe your doctor has looked at for you, such as an ANA or an anti-nuclear antibody. That is the most nonspecific antibody for autoimmune disease, and about 10 to 15% normal healthy people may carry it in their blood without any consequence. But when we see someone with a referral with a positive ANA and certain symptoms, as I mentioned before, we always want to check for more specific antibodies. So another few important ones that you may hear about or know or you may have is a double-stranded DNA or Smith antibody. Now, you don't need to have both or all of them to have the diagnosis of lupus, but it certainly helps in that case. Another big aspect is something called antiphospholipid antibodies, which are blood clotting antibodies. So that's always something else that we check too. And the three that make up this particular set of antibodies are something called a lupus anticoagulant, a cardiolipin antibody, or a beta-2 glycoprotein. And again, you don't have to have all of them, but certainly some of them help us gauge towards the diagnosis. Another big thing we look at are called complement levels. So these are part of the immune system, and you may recognize them as C3 and C4. What we see when immune activation is going on is that these complement levels will drop. So you may see lower C3, C4 levels when your disease is a little bit more active, and then they'll come up naturally as your disease is being treated correctly. Another big thing with lupus patients that we always want to screen for is something called lupus nephritis, which is involvement of the kidneys. Now, this is super important to screen, and it's easy to do so because the main thing we always want to check is a urine sample. You want to look at the urine to see if someone is leaking protein. So that's a big aspect of how we screen for kidney disease. And also if your blood pressure is going up and there's no other cause, or you're getting swelling in your extremities, or you've noticed some extra foam in the urine, that can also point towards that you're losing protein through the kidneys or through the urine. So going down to the next question here, I have, if you suspect you may have lupus, what should you do if you do not have a rheumatologist? So there's been a lot of data looking at how long it takes for a patient to be diagnosed with lupus from the onset of symptoms. It can be up to 10 years, which is far too long. We know that early diagnosis is critical to getting lupus patients under control. Specifically organ damage, if you can prevent it in the first 2 years, is very important for your prognosis in the long run. The Lupus LA is a great organization that actually will have referrals to rheumatologists, various rheumatologists in town on their website. So that's something you can look at, as well as discussing with your primary care physician how best to refer you to a rheumatologist that might be a good fit for you. Number 3 here is, what specialist should you add to your team once you get a diagnosis? So as I had touched on before, depending on what symptoms you have and what organs might be affected, that will determine which specialist that your primary care physician or a rheumatologist will refer to. So I, as a rheumatologist, when I identify certain disorders, I will direct patients towards where they need to go, and thankfully I have a very good team of multiple specialists, pulmonary specialists, dermatologists, allergists, nephrologists, kidney doctors, depending on what's going on. So it's not that necessarily once you have a diagnosis of lupus, you need to go see 10 different doctors. And certainly getting a diagnosis of lupus can be very overwhelming. So I never want to immediately, after meeting someone, send them to 5 other specialists, because then as the patient might know, you might be confused about why am I going so many different places? Why can't one person handle it? So I try to be the quarterback for the patient, as well as having a good primary care physician to do that. So I have another question here, which is the process for monitoring lupus the same for lupus nephritis? So as I touched on before, lupus nephritis is related specifically to kidney inflammation. And patients can also have lupus nephritis without having visible signs of necessarily systemic lupus, like you may not have joint pain, rashes, lung inflammation, anything like that. Although by definition, having involvement of the kidneys usually means that you do have systemic lupus on top of the lupus nephritis. So lupus nephritis patients should be appropriately diagnosed via kidney biopsy. So I always screen with a urine sample. If I see that a patient is now leaking significant protein in the urine, say 1, 2 grams, 3 grams from barely anything a few months ago, I would send them to a kidney doctor. That kidney doctor would then assess the patient, usually schedule a kidney biopsy. And why a biopsy is super important is because there can be other sorts of kidney diseases too, sometimes from drug toxicity, other things like that, hypertension, diabetes. So we want to make sure we're treating the right kind of kidney disease. So getting a biopsy also will classify how severe your lupus nephritis is. So lupus nephritis is treated all the way from class 1 to class 5, and most people generally fall around 3 or 4 to 5, and depending on the severity, sometimes we need to use IV medicine. Some of you may be familiar with cyclophosphamide or Cellcept, which is a pill that works really great for lupus nephritis. More recently, IV Benlysta and subcutaneous Benlysta has been approved for lupus nephritis as well. And so many of you may already be on that for systemic symptoms. And so that's helpful because we know that also helps in lupus nephritis. Voclosporin is also a newer medicine that has been approved in the last year. Those are pills that you take every day, and that can also help for lupus nephritis. So going down here, let me just check in with the comments. Okay, I'll go down the questions and I'll try to answer some of these questions too. So number 5, how long do flares usually last for lupus patients? So if untreated, flares really can go on for quite some time, and I've had patients who sometimes aren't so good about reaching out when they need to. And so they'll have had symptoms for 2 weeks, 3 weeks, even a month before coming in or letting me know about it. Now I have the patients who are proactive and they tell me, right away. For example, their joints are flaring up or they're having pleurisy, which is inflammation of the lungs. And so that can cause a lot of sharp chest pain when you take a deep breath in. Or a rash, when patients have sort of what I call a moderate flare, which is not necessarily anything affecting their organs inside, but how they feel. I usually do a short course of steroids, and so some patients may take a Medrol pack, or they might have some prednisone at home, and most of you probably do. And I personally like to do prednisone 20 milligrams for 3 to 5 days, and that usually calms everything down so that you don't end up in a more severe flare. But every patient's different, so of course you want to talk to your rheumatologist about what would be best for you. Now, another question is, do lupus patients always need to be on medication, or is remission possible or common? So 30 years ago, the spectrum of lupus and the prognosis of lupus was very different from how it is today. In the last few years especially, more medicines have been approved for lupus. It's always been a hard disease to treat, but now, thankfully, in the last really decade, there's been multiple new medications that can help patients, and we can have a chance to tailor medications to different patients, whereas before you might only have a few pills or steroids that you keep taking. So newer medicines within the past decade, as I mentioned before, Benlysta, which comes as both an infusion or a syringe. Another one most recently is called anifrolumab or Safnello, and it's an IV infusion once a month, and it's a new mechanism of action. It actually is anti-interferon, and we know that many lupus patients have what we call an interferon signature, which if you target that can help decrease inflammation and also control the lupus better. I always feel, and every rheumatologist I speak with will talk about being more aggressive with medications and treatment in the beginning of diagnosis, because as I mentioned before, the first few years are critical. So you want to treat more aggressively in the beginning, and that's what I tell patients is if we calm the inflammation down now, you'll have a better outcome, and then we can slowly taper medicine off. A lot of patients may not want to start medicine right away, but kind of hearing that, okay, if I calm it down now, maybe I don't have to be on it in the future, oftentimes convinces patients to start their medication sooner. Remission is certainly possible. What I see also is that because lupus is such a hormonally driven disease, it tends to be more active in premenopausal women. And once you hit menopause and your estrogen levels drop, oftentimes the lupus, I call it, burns out, so it goes into remission. And oftentimes many patients are able to taper off their medications or at least get down to the minimal dose that they need. Another question I have is what are the most common lupus treatments? So typically, I've already mentioned a few here, and what we separate medicines into disease-modifying anti-rheumatic drugs, or DMARDs, versus biologics. And typically, the first medication that we start for lupus patients is called hydroxychloroquine or Plaquenil. It's not an immune suppressant, it's an immune modulator, but it has been shown to decrease the risk of flares and organ damage in the future. So it's pretty much a bread and butter medication for all lupus patients. It's pretty well tolerated, and just once a year we ask that you get your eyes checked due to the risk of retinopathy from the drug. And then in that category, we also have methotrexate, or you might have heard of Imuran or azathioprine, Cellcept, leflunomide, various medicines that are not as immunosuppressive as biologics, but oftentimes are enough to control each individual's disease. Going into biologics, I've mentioned Benlysta and Safnello. Now, there's also lots of other medicines that sometimes your doctor might use, quote unquote, off-label, as in they're approved for rheumatoid arthritis or other sorts of autoimmune diseases, but also work quite well for lupus, so we try to use that as well. How often should you have your labs checked when you have lupus? So most patients with moderate lupus, if you still have a little bit of activity going on, I would say most people check in every 3 months or so. If you're critically ill, we see patients every 2 to 4 weeks as needed. If you're really good, you can go 6 months or a year. So again, it just depends on where you're at, and over time it might change as well, whether you go into remission or you're in a flare. Speaking of flares, the other question here is, during a flare, how can I tell when to call my doctor or go into the emergency room? So again, this depends on how severe the flare is. If it's something you've had before, you kind of recognize what it is, as in maybe it's your joints or your skin, you can definitely contact your doctor first. The main serious events is if you have any neurologic deficits. So if all of a sudden you're having trouble speaking, you're having trouble seeing, you have an acute headache that is just not treatable by anything over the counter, or chest pain that feels like it potentially could be a heart attack, that's stuff you got to go to the ER for right away. Most everything else you can contact your doctor first. Another question is, what are some of the main side effects of lupus medications to look out for? And this is pretty complicated because there's so many different medicines and we don't have time to go over every single one today. But I would say a big side effect with the pills, obviously, and with most pills, are stomach upset, nausea, diarrhea, that sort of thing. Generally, the biologic medicines are pretty well tolerated, so I'll leave that to a discussion with your personal rheumatologist, since everyone's going to be on different medication. Another question is, how can I be proactive about preventing organ damage? So a big thing is showing up to your appointments. That's the main thing, because a lot of what we do is doing your blood work, doing your urine, and also physical exams. So as long as you keep up with that, your rheumatologist will do their part to make sure that you are not going into organ damage. So another question here is, how long does it take after diagnosis to get your lupus under control? This again depends on how severe your lupus is. Generally, we try to calm down inflammation right away with steroids, but that's not a long-term solution. It's really just because it's the medication that works the most quickly. And while we are putting you on steroids and tapering you down on that, we usually decide on a certain medication called a steroid-sparing agent that will be your maintenance medication. So some people, within a month start feeling better. I would say 3 to 6 months is the time period for getting it completely under control. But you certainly might feel better within a few weeks of starting medication. And then the last question I have here is, will I be able to live a normal life with lupus? And I always tell patients that yes, that's the goal, is to get you back to your usual self, your normal self before you were diagnosed with lupus. And so we're going to do the best that we can by monitoring you carefully, making sure you're on the correct medicine, making sure you can tolerate the medicine. And then you as a patient, we count on you to take your medicine, to make sure you have your follow-ups, and to always contact us if you have any questions. Finding a rheumatologist that you can connect with and you don't feel intimidated or feel judged by is super important, because it's a relationship that you're going to have for a long time. This is a chronic disease, so you want to make sure you can communicate freely with whoever's treating you. So that concludes my questions here. I will also look down. We've got about 5 minutes, so I'll just look down here at the comment section and see if I can quickly cover anything here. Okay, so I have Trisha asking, how effective are Benlysta injections? And I've already mentioned Benlysta a few times here, and I obviously, if mentioning it so many times, I'm a fan. So it's a good way to, the infusions came out first, and then the injections are just easier to do at home if you travel, if you otherwise live far away from your doctor. Being able to self-inject every week is very useful. This is a drug that can take a while to kick in, so usually I would say probably 7 doses or so is what the magic number that I tell patients to look for. You'll start feeling better. Typically, a lot of those, what I call constitutional symptoms that aren't necessarily identifiable on blood work, people will start saying, I feel better in terms of my improved fatigue. I'm not as tired anymore. I'm not as achy anymore. I'm having less rashes, and that can be very meaningful because fatigue is so non-specific and it's very hard to otherwise identify on lab work, and Benlysta really helps with that, as well as with lupus nephritis and other conditions too. So looking down here, so Dana says, I have lupus and was just diagnosed with COVID. Are there any special potential complications I need to be aware of? So thankfully, a lot of our patients have evaded COVID during this time, mostly partially in part by being just very, very careful, but with especially the Omicron variant, it's just so contagious. It's everywhere. It's really hard to avoid unless even if you're at home all day, it can be brought to you. So generally everyone's done actually quite well. Most all my patients have stayed out of the hospital. The patients that I send to the hospital are usually because I want them to get a monoclonal antibody treatment, which are only really given in hospital settings. And over the course of these past 2 years, there's been so many, thankfully, new medications and treatment options. There's multiple infusions that are available. Now there's Pavloxid, which is a pill that you can take to minimize your symptoms at home. And of course, the vaccines are super important. If you haven't gotten your booster, get your booster now. They really do help. There's really few people that actually have contraindications, and I encourage all my lupus patients to get vaccinated. So someone else has asked about mycophenolate effectiveness. So that's also called Cellcept, or there's another version called Myfortic. This one is a great drug as well, and we use it oftentimes. It works specifically for lupus nephritis or people who have interstitial lung disease. So it's a good option. It's not for everyone, but depending on your symptoms, it can be very helpful. Now, Nashali says, I have lupus systemic and lupus nephritis, and can I get pregnant? Is that possible? Yes, lupus patients, we sometimes joke, are particularly fertile, but that's just us in the clinic saying that. You can certainly get pregnant. It's very important to have a very good high-risk OBGYN on board who understands all the risks with lupus and pregnancy and lupus. If it's something you're thinking about, you always want to let your rheumatologist know to make sure you're not on any medicines that might be teratogenic or fetal toxic. But we have had multiple patients with lupus successfully become pregnant and deliver healthy babies. Okay, so we're coming up on the end. Let's see if I can answer one more. Let's see here. I think we can cover everything. So we have someone else asking, they have Hashimoto's and lupus. They sometimes have muscle tics and joint pain, sometimes can't walk on their legs. So yes, it sounds like you might have muscle spasms, and that can be related to multiple things. Maybe if you have any back arthritis, that can also cause some muscle spasms. Generally for muscle spasms, which I wouldn't say are a lupus-specific symptom, magnesium can help. The joint pains definitely can be related to lupus. Okay, so this is about towards the end of our 30 minutes here. So I'm happy to answer any more questions that you guys might have. Just feel free to leave them in the comment box here or email Contact Lupus LA. I work with them often, and I'm happy to come back on and speak with each and every one of you if you have any more questions. Hope you have a good day.